All right, so we're recording. So, welcome to our presentation, kind of focusing on MyChart. I've got a bunch of stuff to go over with MyChart. I've got a few more things to go over just on our brief discussion at the beginning of this. And hopefully we can get all those questions answered. And then we're going to kind of go into a little bit of the pharmacy apps as well. So apps that you might be using for your medication refills and stuff.
Oh, good.
Um, so with MyChart, like I said, I really only use it with my daughter's health. I don't really use it for my own, as terrible as that sounds. But it's been a big help. I am mostly basing this off of using it on my iPhone with VoiceOver, and I found that the accessibility is pretty good. Is anybody using it just with like the website?
I use it.
I would like
I
to.
do.
Yeah, I do.
I
Okay.
would like to.
Okay, so that might differ. I've seen the websites. I've gotten kind of, used to the layout and how they would work and how I would believe that they should work with JAWS. And they should be fairly accessible. I think it could be an option where if you're on the website and something isn't really being accessible to you, you could maybe try hopping on a smartphone and see if it's a little more accessible. I know we talked about somebody mentioned reading the charts and stuff. The test results are always going to be a kind of a challenge, I feel like, just the nature of it. But hopefully
They
we
used to
can.
not be.
Used to not be. Yeah.
No, they
I
used to
was.
be either written in narrative form or they were a text table, and it was a very simple table. Now since they've added the
The view
history,
trends thing.
yes, it adds a whole nother layer or several layers to accessibility, and you can hear the numbers, but you don't know what the numbers are being applied to because,
Right.
yeah. Anyway.
So originally my game plan was to kind of cover my chart and also a different one that I think is, I want to say, exclusive to Advocate, which is called Live Well. In kind of researching for today, I actually discovered that Live Well is no longer its own separate thing. It is part of my chart. So that kind of simplified the focus of today a little bit. And looking at Live Well today, it's still called Live Well, but the layout is identical to my chart with my own personal, medical provider and, looking at other images. So the layout should be the same and all this information should stay, relevant for everybody. The first thing is getting, set up with your my chart. It sounds like most people on here are already set up with it.
I'm not set up with it yet. I'm new.
Okay. So what you would do is call your medical provider, your doctor's office, and tell them that you want to sign up for it. Generally, what they'll do is they'll send you an email with a link that you can go through and verify your information and get logged in and everything. Once you're logged in to sign in with the apps, they can be a little tricky. A lot of times they'll have the two-step verification attached to it, so they'll text you a code to log in. With logging in on the apps, if you get the text message in, there's actually an autofill option that pops up when you activate the text field to enter the code that will autofill it from your messages. Same thing if you have it emailed and you have the mail app open. When that email comes in with the verification code, on the text field in the app above the keyboard, there should be it'll say from mail, and it'll read the code. You double tap on that, and it automatically enters the code. Makes that kind of process of remembering those digits and trying to get back to, the app and typing it in and all that kind of clarifies all of that.
And quick question, it'll do that from the mail app that comes with the phone, but will it do it if you use Outlook or a third-party app?
No, it's only the
Got it.
default mail app. Thank you for
Got it. Thank you.
reminding me to mention that. Yeah, it won't do it for Outlook because I've tried that with my work email being through Outlook, and
Yeah,
it does
mine
not
is
carry
too.
over.
Mine is too.
So once you're logged in and you're ready to go, there's a couple different things on the app that you want to be aware of. So at the top left of the screen, the first item that your screen reader should land on is your menu button. This is a very long list of every possible thing that you can do with MyChart. And it's broken down into sections of, find care, communication, your records, billing, insurance, sharing, resources that you can look into, and then your settings for the app or the website. It's kind of a long list, and what they've actually done is across the top, there is 6 different commonly used options. And I'll list those out, and then we'll go into each one of these as we're going along. The first one is schedule an appointment. The second one is request a refill for your medications. The third one is messages. The fourth one is visits. The fifth one is test results. And the sixth is billing. And I believe on the website it's the same process for that. They're laid out the same. Underneath that, as you continue on down the screen, you have kind of your recent items. And there's kind of your notifications, if you will. These usually include, upcoming appointments if you have any, reminders to schedule future appointments if you need to. Any billing that you have, if your bill's coming up due, and then some other things as well. One thing with this is these notifications, if you have more than one person under your MyChart account, it'll list that other person's underneath the primary ones as well. So like I'm looking at it right now. My daughters are the first notifications, and then underneath that is my wife because she uses the same account. These notifications kind of stay where they're at for a long time. Unless you address them and do, whatever. You pay your bill, you schedule that appointment, they should stay there. Do I have any questions so far? All right.
What are these notifications for? Again, I mean, are they specific to us, or are they like general notifications?
It'll be specific to you.
Okay.
So if you log in and you're on like your profile, the first ones that you hit after those like 6 kind of commonly visited tile things, the first notifications will be what's recent and relevant to you. So if you need to schedule an appointment with a certain doctor, it'll be there. If you have a prescription that needs to be filled, it'll be there. If your bill is due, it'll be there. It's kind of just like condensing everything and making sure that it's easily available to you.
Okay, thanks.
Mm-hmm.
Is there an app that needs to be downloaded from the App Store, or are you talking about the website?
This is kind of the layout of the app that is the MyChart app, and then also the website should be the same as well.
Thank you.
All right, so the first kind of commonly visited area that will be across the top of the screen is schedule an appointment. When you activate that, it will bring up a couple different options. If you have like a referral that's ready to schedule and you haven't scheduled yet, those will appear there. These are the same that appear in the notifications as well. Underneath that, it lists schedule with a specific provider. And this is where it gets a little tricky because like I'm looking at it for on my account right now, and I'm only seeing 3 doctors listed. So that might be where it's the recent thing that was a question that we had earlier. And then further down from that, you have kind of to start a brand new one. So you can pick, it's labeled tell us why you're coming in. And underneath that, it has immediate care, physical, if you need that, a video visit, which is the telehealth. We'll talk about that a little bit more in a second. You can schedule your flu shot directly here, orthopedics. And then there's another option that's all options, and that brings up an even longer list of every kind of, specialist that you would need or want to see. Once you click on any of these, it takes you into the next step, which is to schedule your appointment. And it asks you what kind of appointment you're looking for. So I clicked on, the general physician, and it pops up with 3 options. So you have to get a physical, if you need a physical, an office visit, which would be to start, just a general, appointment. And then you also have an option for telehealth there. So a video visit with my provider. Once you pick kind of your type of appointment, should take you to the next screen. And that will include the location of where you want to have the appointment. So if there's multiple locations for your provider, they'll give you that option. And then the next section is the time and the date and when you pick it. And then the last step is to confirm your appointment. So it brings up a bunch of options when you get to that date and time. Looking at mine, it's labeled by what's available. So like today, the position is available at 1:30, 1:45, and 2, and then it gives Wednesday. So it gives you multiple options to schedule your appointment. And then the last step is just to confirm it. But that's kind of scheduling appointments. It's
Wait,
pretty.
I have a quick question.
Yes.
So the date and time, that's no longer a picker item that you have to activate.
No, it's options on the screen that you would
Oh,
navigate
good.
through.
That has changed because
Yeah,
before it was picker items, and the picker items, that was not accessible.
Yeah, and a lot of times those aren't accessible, and even if they are, they're kind of a pain to just get through. So this kind of is giving more buttons that are just buttons with, the time on it, and then they're listed under the date.
Okay, thanks.
But then once your appointment is scheduled, it should show up on your main screen when you go back out to the home, the first landing area, and your appointment should be one of your notifications now. With the telehealth, that is something that's becoming more and more of an option, and it became real popular during the pandemic, obviously. And that gives you, an option to not wait as long to get into the doctor. And it also, you can do it from the comfort of your own home. When you schedule an appointment for telehealth, that's where you would, let me pull it up real quick. So it follows the same process. You schedule the appointment and you pick your date and time with all the options that we, kind of covered already, and you confirm it. Once you have it confirmed, that's where you would go to another section, which is visits. And this is where I found this a little confusing, but schedule an appointment and visits are 2 separate options. So when you go to visits, it gives you any future appointments that you have. And then it also lists any past appointments you have. And under those past appointments, there is an option that will pull up a visit summary that the doctor has written. And then also you have view clinical notes. And that gives you more in-depth of, everything that was covered, any medications that were prescribed, a bunch of stuff. For the telehealth, when you have a telehealth appointment, you go in and underneath your visits and your future visits, you'll have your telehealth appointment listed there. You would tap on that, and 30 minutes prior to the appointment starting is when you can actually get into the telehealth appointment. And so when you click on that future appointment, there'll be multiple options that gives you, you can reschedule it, add it to your calendar. You can call where it's, call the office and all that stuff, but there'll be an option that will launch the video visit. If the video visit's what it's listed on mine, it might be different wording on somebody else's. When you're doing this, if you're doing this on, I think both a PC and an iPhone or a smartphone or a tablet, you'll have to make sure that you're giving access to the microphone and the camera, and those should pop up as dialog boxes, either in your browser or on your screen. And these are necessary so that you can talk and the doctor can see you. So this 30-minute period is, I feel, important because it gives you ample time to go through all this process and get the permissions for the microphone and the camera set up. And then you can kind of get everything in order before your actual appointment begins. The telehealth is launched within the app, I believe. If I'm wrong, please do correct me. But I believe that the telehealth launches either in the website or in the app, depending on whichever you're using. Do I have any questions on that? Okay. Going back to our kind of 6 main areas that we want to look at. The second one is request refill. And this is where you can request refills on any of your medications. When you activate this, it starts listing off all of your medications that are in your record. And each one, it gives you, the name, also what it's commonly known as, and then the directions. And then the additional information underneath that, there's a button to request a refill. And then there's also a button that you can remove that from your list of medications. So if you know you're not going to be taking this again, it was kind of a one-off medication, you can remove it. And it won't show up in your list anymore, which might make it a little easier to go and find one of your other medications. But once you request it, it will put it in the request to your provider, and then they will either approve it or deny it. And then you'll get like a notification and a message about that as you're going through.
I have a question.
Yes.
Okay, so I have been afraid to remove medications because the medications that I wanted to remove were duplicates. Because sometimes if they don't use the old prescription, if the doctor does a brand new prescription instead of renewing an old prescription, it'll put it in your list like 2 times or 3 times or whatever. And I was afraid that if I removed the name, it would remove them both from the list. Do you know with duplicates, does it only remove that one or will it remove both of them?
I'm not sure, and I'm
I
cautious
know, no one wants to test it,
recommend
and
it.
I get it. I know, I don't want it, so I always just ask the doctor to remove the old ones when I'm there, but it would be nice if, yeah, okay, thanks.
Yeah, because like looking at mine, I have a medication on there it's the same medication, but it's a different two different forms of it. And I do get the notification as I'm like going through the information,
Yes,
and it says you
yes,
have another medication with the same name. But I don't know if you remove it if it's going to get rid of both of them
I know,
because
that's
they are
why,
still listed differently. You know, if there's a
right,
difference in the dosages and stuff, that should change it. But I do believe that these are listed kind of in order as the
yes, they
most
are,
recent one.
chronologically, yes,
So, like, I suppose what you could do is just start at the very bottom of the list and start removing your old medications that you know you're not going to need anymore, and keep it more up
hmm
to date. But yeah, as far as removing ones that are the same name and potentially messing yourself up with getting medication you might need, um, yeah, I can't really say one way or the other.
yeah, because I've done the other, I have removed ones that aren't duplicates, but anyway, okay, thanks.
All right. So that's kind of the requesting a refill. There's not a whole lot to it. The next section is messages. And this is the one that we had some questions about and we got some answers too. And I'll reiterate those just so it's on the recording as well. So with messages, when you go into messages, it brings up the list of your most recent message from any of your providers, and this could be your doctor, lab techs that are giving you your test results. It can be about appointments, it can be about billing, it can be about changes to your appointments, and just general case management as well. At the very top, there is an option that gives a drop down menu. And this is kind of how you can sort your messages of what you want to look at. So conversations is the default, that's what it opens to. But then you have bookmarks, so you can bookmark one of your messages, and then you can come back to that message. This might be useful if it's a doctor that you haven't messaged in a while and you're having trouble getting back to messaging them. If you bookmark that conversation, it might keep it in your list and you might be able to come back and send a new message. Um, the next item in that menu is appointments. So if you only want to see your messages that are focusing on your appointments, you can do that. And then there's also automated messages as well. Then there's also the trash option too. So if you accidentally delete a message, you don't lose it automatically. You can come back to it if you go and filter that. There's also a search field on messages. So if you're looking for something that's about, a specific topic, you can search for that specific topic and it will pull up any messages that are on that topic. And then when you go into a conversation, this is where it gives you your list, and this is your messages and the messages you've received, and it's almost like a text conversation and on a phone. So you have your back and forth. There's a more option at the top. That's a more options menu that brings up print. So that is something that is new with the apps and the website. Prior to, it was very difficult to print information off of this app and the website. For confidentiality, it would blank out anything. So I had one client who needed to print out, I think it was a billing invoice for a recent procedure. And we tried printing it, and it would print out the layout of the app, but then where all of that invoice was just a blank page. Um, I got to work around with it where I think I think I ended up taking screenshots of it and printing the screenshots, and that worked. but they've brought in, you can actually print directly from the app and the website now. It's kind of a weird confidentiality thing, I guess, but it's been resolved. At the very bottom of your messages, your conversation list is send a message. And when you tap on this, it brings up kind of a couple different options of what type of message you want to send. So you can schedule an appointment, you can request a refill, you can ask a customer service question, or you can ask a medical question. When you select one of these, it will then bring up the same list as so if I tapped on schedule appointment, it brought up the same list, the same page that was available when I tapped schedule appointment from the main homepage of the app. Let's see here. When you tap ask a customer service question, it brings up more options for topics where you can ask about billing, you can ask about insurance questions and referrals. And then a medical question is kind of not related to scheduling or anything. You can just ask, and then it breaks it down by a non-urgent medical question regarding a recent visit or a test results question. So this is where if you pulled up your test results and you weren't sure what it means, or it just wasn't accessible with your screen reader, then you could ask this question. Once you do a test results question, then it brings up your providers that are listed. And this one looks pretty thorough. It's hard to say because it's my daughter, she hasn't been around, but we do have a pediatrician listed on here that the previous appointment was back in 2022. So that might be where you could find that, doctor that you were trying to get in touch with that wasn't appearing in your list.
That's under, that's not under non-urgent medical question. That's under
Test
test
results.
results?
Yeah.
Got it. Okay.
But I believe
Okay.
if you hit
Because I've done it
non-urgent,
under non-urgent, and that's where they've disappeared. And it could just be that hospital, but
yeah, it could be. And then as we discussed earlier, when you're on the homepage of the app or the website and you bring up the full menu, there is an option under that which lists, you can view your care team. And that should list everything, every doctor that's, ever been listed for you on the app or the website. And that should bring up, and then when you activate those, you should get an option to either send a message, schedule an appointment, or you can hide the provider. So if it's a doctor that you're not going to see again, you can technically hide them from your list.
Cody, this is Adam.
Hey, Adam.
Hey, I'm probably shown as the iPhone, but here's my question. My chart is hospital specific. That's my assumption. And here's
Yes.
the question. Do they have a list of doctors by their specialties where you could go and let's say there is a doctor you saw 5 years ago and you said, oh, I want to get in contact with that doctor. Can you go to that list? And if they're still with the hospital, can you like highlight them and then will you be given the option, send a message?
If I'm not sure if they're no longer with that, network or whatever, they might not pop up anymore. That is a very good question.
But if they're still with the network or the hospital,
Yeah.
and you find their name, which I assume the doctors are all listed by specialties, and if I go and highlight that doctor, then is there any like pop-up menu that say, do you want to send a message? Do you want to schedule an appointment?
Yeah.
Um,
Yeah, they should pop up, and then once you tap or click or double tap on their name, it should bring up a menu where you can send them a message or schedule an appointment or hide them from your provider, which wouldn't be relevant for this situation. But yeah, you should be able to find them.
okay. Thank you.
And then there's also an option in that same menu underneath your care team where you can search by locations too. So that might give you a little bit more information if you're looking for somebody specific. And I would say also, like, if all else fails and you're having a hard time finding this provider that you might have seen a long time ago, you could also go to your visits page that we discussed earlier and navigate through all your old visits. Um, I'm looking at this now, and there's it's going back the entire medical history. Every visit I've ever taken my daughter to, actually. I have when she was discharged from the hospital, actually. Um, that was 3 days after she was born. The only problem with that is there does not seem to be like a filter option for the past appointments where you could say like, okay, I only want to look at this cardiac physician I saw or something else. Doesn't look like you can filter it, but it should be listed if they were in there even. And the good thing about this website and this app is it's your medical record, so nothing goes away really unless you delete it from your history. I know we had that issue with the messages with the providers disappearing, but for the most part, everything stays there. Your notifications, they won't go away unless you go and look at that thing or do the tasks that it's notifying you about. All right, so our last of the six kind of common areas that you're going to be going to is the one everybody enjoys. It's the billing section.
Oh, yeah, right. Uh-huh.
So there's not a whole lot to this one. If you tap on it, it will tell you if there's any amount due. It will give you an option to pay now, so you can make your payments on the website or in the app. It will tell you the last time that you made a payment. And then there's also an option to set up a payment plan if you need to. And then the list after those buttons is you can view your balance details. It will list your last statement, so you can download your last statement. Um, Contact customer service and manage payment methods. So that's pretty straightforward. Um, if you want to pay your bill, you would activate Pay Now button, and that would take you through the steps of how much you want to pay. You can enter a specific amount, or you can pay off the balance, and then you would select your payment methods, and then you would finalize the payment. Um, it's like the least fun part of this thing, but it's important.
Cody, is credit card one of the options?
I believe so. Let me see.
You want to use a credit card for payment?
Yes.
Okay, good. Because I do everything with a credit card.
Yeah, it's an option to make that your payment method. Um, Actually, I want to circle back real quick to that test results section because I know we had questions about that. It definitely changed because they added this view trends thing. But honestly, the test results thing, when it has that narrative, that's great because it explains what any of this stuff means. Um, Without that, it's hard to know, right? Like I I didn't go to medical school. I don't know what any of this stuff means. Like, give it to me in simple language, right? The
Right.
trends, they don't really give that much information past that. You can save a table of your results to a PDF document. If I had to take a guess, I would say that's probably not an accessible PDF. Um, but what I would do is when you go to the results, at the very bottom of the page, it will give you the ordering provider under additional information. What I would do is if you have questions about it, it's, you can go then navigate to your messages section and send that provider a message.
Saying what does it mean or whatever.
Yeah, like I saw the test results. Could you, tell me
Explain.
what they mean? Because it might as well be a
All
different
Greek.
language. It's all Greek to me.
Yeah.
And a lot of times, like your provider will send you a message about your results to say, hey, we, did this test. This is what it means. Please follow up with your PCP with that. Um, and then you can ask a question directly from there too. But I feel like that also varies from hospital to hospital and how, you know, involved they are with the messaging and stuff. But you do have an option to always go back and message them directly and ask them if they don't already offer that.
Cody, this is Sharon Howerton. I had a question for you or a comment.
Yes.
So one thing that I use a lot that's a little bit troublesome is the e-check-in when you have an appointment
Mm-hmm.
and you get a prompt email indicating that you can e-check, check in. And sometimes it all seems to be filled in and other times it's like, I'm not always sure what they're missing. And if that happens, I just log out of it and let them figure it out when I get there. But
In all honesty, like they do a lot of that, like fill out a questionnaire before you
yeah,
come. And I feel like sometimes you fill that out and then you get there
exactly.
and they ask you the same questions
Yes.
anyways.
Yeah, that was the
Yeah, so
same
it's,
me to
I mean,
do.
in some ways it's convenient. The other thing was, they ask you to add your contacts, and so I did that. And when I was in the hospital back in January, um, one of my sons or my daughter, one of them wanted to check in and see what was going on, and they didn't know how to get into it. And I put their names in and everything else, but then there's a video that they're supposed to be able to watch to figure out how to get into the stuff, but it's not easy.
Yeah, and usually, if there's like an e-check-in or you're doing the e-check-in for like a
Right.
telehealth thing, if you go to the visits page of those like six and you click on the upcoming appointment or the future
Yes.
appointments, it should list any of those like questions or e-check-in stuff that should be
Uh-huh.
listed somewhere on that page.
Okay. Okay. Thank you.
Cody,
No
this
problem.
is Gloria Petri. I'm a real newbie. I have never tried my chart. So
Mhm.
way back to the beginning, when you say we get a code, each time would we get a different code or do we get the same code forever?
Um, you mean like the login codes?
Yes, once we start and then they send us a code, is that code always the same or will that code be different?
No, it'll be different and you shouldn't have to do it all the time.
Okay.
If it's been a while since you've logged into like the app or the website, you might have to redo it. I know when I logged into this last time, it did the code thing, but since last night, I've opened it probably 20 times getting ready for today, and it hasn't prompted me to enter that code at all.
Okay.
So if you're regularly logging in, it shouldn't require the code. I feel like it does it after a certain amount of time just to protect your, confidential information because this is, out of all the things that we want to keep confidential, your medical records are probably, up there
Yeah.
to the top.
Oh, yeah.
Yeah.
Absolutely.
Yeah.
Cody?
Thank you.
Yes.
I'm Jimmy Sue Castleberry, and I've never done this before. I mean, I'm a newbie too.
Mhm.
Yeah,
So,
that's why we're
how
here.
do I log in for the first time, and especially if I'm doing it on the computer? How do you log in for the very first time if you've never done it?
So you would want to contact your doctor's office and ask them about getting set up for MyChart. And what
Okay.
they'll do is they'll probably send you an email with a link in it. And when you
Okay.
open that link, it will take you through all the steps of,
What
getting
to
set
do?
up and verifying your information and verifying that it's you setting it up. And that it's kind of a pain, but they're, doing that to make sure that, it's not, it's you and not somebody else doing it.
But once you're in, right?
Yeah, so during that process of, putting in all of your information, I believe it might ask you for your social security number and all that stuff. And then it'll ask you what your username and your password would be. Once you kind of enter that and go through all those steps, then you should be good to go.
Well, do you have a username and password for my chart, or is it the username and password for your email account?
You could make it different or the same. It's up to you. But
Oh,
you would have your own username for my chart.
okay. And then the other question is how to read tables, anything that's written in tables. How do you read them?
That's where it's going to be tricky depending on if you're on the website or the app and what, accessibility you're using and also just how the table is laid out. And that's where I would probably recommend just messaging your doctor or your provider and asking them, what does this mean? What was in that table? Like I'm not able to access it.
Yeah, right. The only thing I know about tables and I had a table once that gave a schedule of things that were happening, and you hold down the Alt and Control key and use your arrow keys. I don't know if that would work or not for this.
I don't believe so. If anybody else knows, feel free to chime in, but I don't know if that would work.
This is during if you're on the computer and it's set up for the Windows navigation,
I've got
the
Windows
keyboard
11.
navigation.
I've got Windows 11 now.
Yes, but if they have set it up for keyboard navigation, then if the Control Alt arrow keys does not work, what I've tried to do is go to the top and then I've pressed the T key, and that puts it into table mode. And then I've used the Control Alt and arrow keys. And if it doesn't work, then to me, this is just from my experience, I couldn't make it work if it doesn't work that way. But I usually do it from the phone anyway, but the phone, ever since they've changed the tables, that's what I was saying before, they're very not user-friendly and not screen reader friendly.
Yeah, I've
They're
never done it
doable
either
with the
way,
screen
so I
reader.
don't really know. I'm totally new. I've never done the phone or the computer for my chart, so.
Okay. But yes, that key combinations may or may not work depending on how when they programmed the app or the website for the keyboard navigation. The problem is it doesn't always read the heading. So if it's a table with like 7 or 8 columns, you've got to sit there and memorize like what number goes where if you go 4 columns down.
Hmm.
Or 4 rows down, excuse me.
Yeah, I have all kinds of trouble with columns.
Yeah, and especially, like I said, now that they've put the tables into a bigger table because they show the trends, that makes it more confusing.
Right.
So I've had to email the doctor and just say, you know, I made the mistake. Well, right, because I made the mistake the first time saying, you know, this isn't making sense. And they're like, well, read the table. I'm like, oh my gosh. Okay.
I can. If I
So,
could,
yeah, so
I
I'm
wouldn't
like,
ask you.
right. So I've said the screen reader, the table formatting has changed and it's no longer user friendly with the screen reader. I need you to tell me I need you to explain the results to me in a text format.
Right.
Sometimes it mixes up the numbers. It's hard to tell what the number. Sometimes it's a number that's showing under a trend and you think it's your result and it isn't.
And you think it's a number for the result.
Yeah, so just ask the doctor. It's easier.
Yeah.
Yeah.
They should, if
but
they're a
this
good
one
doc.
time,
Go ahead.
I was just going to say this one time I got really impatient because I knew it was going to take my doctor, like, they say at least 24 or at least 48 hours, and it could take, could take longer for them to get back to you. And so what I've done, but it was very time consuming. I was able to comprehend it once, but I had to spend like an hour memorizing the order of everything. And it was like the new results were like every fourth row, because it was like the top row was the newest, then the row behind it, the row underneath it was the last time, and then the row behind that was the last time. So it, like, let's say it went back 4 years. So I had to keep scrolling, and I had to sit there and count, and it was like, okay, every fourth row is the new information.
It
took me like an hour.
The result, right?
Yeah, yes, I was able to finally interpret it on my own, but it literally took me like over an hour to memorize and understand and navigate through the table.
Right.
So yes, sometimes asking because I did both. I emailed the doctor and then I got impatient the next day and the day after, and I'm like, all right, let me try this again. And it was like literally an hour and a half, and I got it. But it took, because I was like, okay, it seems like every fourth row is the new result. But so then as you're navigating, I had to count, and then if my finger accidentally tapped something, I had to start all over again.
Oh.
I know, and that does happen when you're scrolling on a phone. And then so it's like you don't know exactly where you were, so then you had to start all over again. That's why it took me like literally, like I would say between an hour and a half to get through the entire table. Cody, you were going to say something?
Yeah, I can't remember what I was going to say. That's fine. Okay, so we got.
Cody, do you know, is it always every 4 years that it tracks it, or is it trends different with every table?
Not sure. It might vary depending on the table
how
and
often you've
what
had
it's
the test,
measuring
yeah.
too. Yeah.
Yeah, okay. Because I was going to say if I could, okay, fine, I got it memorized now, but no, that's not the case.
Right. All right.
Yeah.
So that was kind of everything on MyChart. I do want to take a short amount of time and talk about pharmacy apps.
So, Cody, can I ask one other question?
Yeah, go ahead.
Okay, so, and I don't want, I'm not trying to get into a big conversation about this or anything, but I just wanted to ask real quick. I have noticed the vet apps for your pets stuff are very inaccessible. I don't even use them. And just quick yes or no, because I know that this is not what this is about. Do you know if any of those are accessible?
I do not. That is a good question though. I will
I got
that.
I got my cat's vet to email me like the results instead of directing me to my VCA app because it's not accessible. But anyway, that's not what this is about, but it was an offshoot of that because it is, It is medical
Same
records.
ballpark,
But anyway,
right? Yeah.
yeah. So, okay,
Yeah,
so
I
back to
will.
pharmacy.
I'll ask around to the team,
Hmm.
and I'll see if anybody's got any answers, and we'll maybe put together a workshop on that too.
That'd be nice. Okay.
Cody, this is Adam.
Hey, Adam.
Quick question. It does MyChart, when you call the support line, do they have a special accessibility support desk, and then B, do they do co-browsing? I know when I go through Be My Eyes and call Microsoft, they could co-browse where they hop onto my computer when I give them, permission, and go through the security. And then they're able to either tell me where to go on the computer, or usually they want to direct you to do it. Does MyChart have that, where you could get a support person that specializes in accessibility, where they could be on your computer seeing where you're at to help you set up stuff?
Not that I know of, and if I had to take a guess, probably not.
Okay.
Uh-oh.
Just
That would
because,
be nice if they were on Be My Eyes.
yeah, I'm looking
Yes,
at
it
that
would.
service directory right now, and I'm not seeing it on here.
Uh,
Does Second Sons have any influence? I think they're out of Madison, Wisconsin. At least that's where it was developed. Do you have any influence that an email from Second Sons?
I'm gonna be honest with you, probably not. Just a little bit of the background of who manages this. Um, I don't feel confident in that.
Who manages what?
My chart and stuff.
Oh, got it. Okay.
Yeah, they are not on Be My Eyes in the service directory.
Oh, okay.
Okay. We're gonna go a little bit over. So just to run through the pharmacy apps real quick. I tried to cover as many as I feel like, I've heard clients use a lot. Um, Jewel Osco, their app has a pharmacy section. Um, it's a little hard to get to when you open it, and these are just app specific. When you open it, you go to the tab bar at the bottom, very bottom right, to member. And then underneath the menu that brings up at the very bottom is the pharmacy and health. And then underneath that, you have your pharmacy and health profile. You can refill your prescriptions. You can transfer prescriptions. You can schedule vaccine appointments. And then there's also a nutritional option where you can get some information on nutrition. These are all accessible with voiceover, and I feel confident saying that they're probably accessible with TalkBack too on Android. It's Jewel is, it's all right. It's a little bit buried. I would prefer to have it just there when you open it, but it's still you can get through it. The other one that I looked at was Mariano's. Um, it's accessible, but like Jewel, it's also buried in a menu. From the main page, you go to the top right to the More menu, and then down to the section labeled Wellness. And then underneath that, you have an option to schedule appointments for like vaccinations and look up um, your prescriptions and refills and all that stuff. Losing participants. Um, CVS is accessible and it's easier to navigate, but I also had problems with this. So there's a tab bar that goes across the bottom on the CVS app, and that takes you to the pharmacy. The second from the left option is the pharmacy, and once you're in there, That gives you more options for your prescriptions, your current orders of refills, getting filled in and everything. The problem I had with this one was on VoiceOver. The tab bar wasn't easy to navigate by itself. I literally had to swipe 3 fingers up to go through all the pages and get to the bottom, and then start swiping right until it passed everything on the page, and then it went to the tab bar. So that was not the greatest. CVS, I'm gonna have to look into this because I know they do have um, their own audio uh, prescription labels. It's called Spoken RX. I've had a couple clients inquire about this, and it honestly seemed like nobody there was really aware of this program, but it's a lot like Script Talk, if you've heard of that. We'll mention
Oh,
that in a minute.
yes.
It's a little sticker that's on the bottom of your medication bottle, and then within the app, which is also kind of buried in a menu, um, you can actually access it's a scanner, and then it reads the little sticker, and it reads your prescriptions out loud to you. But once again, you've got to navigate through all that stuff to get to the bottom, to get to the tab bar. Then it takes you to another page. You repeat that process to get to the tab bar again, and then it's under more, and then it's the third option on the screen. It's so buried that I don't know why it's like they're trying to hide it on purpose. Um, Walgreens honestly was the best option. Um, from the main page, it's a tab bar, takes you to second from the left is your prescriptions. In this, it lists everything that was recent. You can request a prescription refill from there. You can refill by scanning the barcode on your pill bottle, and it takes a little bit of practice, but it's possible to do that. You can transfer your prescriptions. You can set. Here's the cool thing: you can set a pill reminder on the app that pops up as a notification on your phone.
Will it make a noise to
Yes.
remind you?
Yep.
You'll get
So
a noise, okay,
you
a
can
sound.
add it, and let's do this. So you can set it up for the frequency. You can set it for every day, specific days, interval, as needed, and then you can set up the times per day. And you save it, and this is all accessible too. Turn on.
Fort Walgreens, a Celestine 0.1, unselected interval tab 3 of 4, unselected as needed tab times per day, decrease button 1,
And you
increase
set
button,
your times per day,
afternoon 2:15 p.m. Take 1 dosage.
and then you set, what times you want it to go off, and then you save it, and then that will pop up as a notification. You can set that notification sound to be whatever you want if you want it to be
Oh.
different.
That's
And
neat.
then VoiceOver will also read it out loud to you as well if you have VoiceOver on. Out of all of these, this is like the only one that has this option. It's kind of odd that none of them do, other than Walgreens. But yeah, in doing a shootout with all of these pharmacy apps, I gotta say, Walgreens takes the cake in terms of pharmacy.
I'm a Walgreens customer.
Yeah, I am too, so I'm a little biased. But yeah, it seems like there's more options. It's more accessible. And then the other options that you have are Script Talk. That's and usually through mail order. But it looks like they've expanded. And when I went to their website in preparing for today, it said that CVS was a partner with them now. So you can get Script Talk labels, which is, the labels, and then there's a device. You set your pill bottle on the device and it reads all the information out to you, what medicine it is, how often to take it, all that stuff. And then there's also an app that you just open and you set your pill bottle on the phone and it scans it. And they are involved. They've partnered with CVS and Walmart. and a couple different insurance providers too, such as Humana.
Oh,
I'm not
Humana.
sure where CVS stands with their own Audible medication labels and partnering with Script Talk. If I had to take a guess, I'm guessing CVS is probably abandoning their own and just going with Script Talk,
Oh,
but I'm not 100% on that. But it seems like that would be the way to do it, right? Like they would just do it for them.
right.
Um, but yeah, the app seems to work really well. It's accessible for Script Talk, and if you're interested, you can reach out to Script Talk if you need that information. Just feel free to give me a call or shoot me an email. Um, I think Walmart's pharmacy was pretty buried in their app too.
With Script Talk, do you have to? You said you have to have a device to set it on, and you have to have an
No,
app.
you can do both, or you can just do either or. The device was how it was, for years, and then they introduced the app, and that it makes it a little more portable too.
So with the app, you just set your pill bottle on the phone,
Yep,
On the screen, yeah.
yep.
and then do you know where on the screen? How do you know where on the screen?
It's been a little while since I looked at it, but I want to say it's kind of up at the towards the top middle, and then that will trigger it.
Well, will it tell you if you know, how how do you know, without you telling us where it is, or somebody telling us? How do you know where it is? Is there audio guidance?
No, you can just kind of feel where your phone is, the boundaries, and just set it. It doesn't have to be like dead on exact, because
Oh, got it. Okay.
it's what's called an RFID chip. That's what, if you use
Yes.
a debit card and you tap it,
Debit
that's what
card.
that
Yes.
uses.
Now,
So
what about if your prescription is in a box?
I think it would still have
You,
the label
you would
there, so
have
you
to
would just
find. Yeah, you'd have to
get the
find
phone.
feel where the label is.
Yeah, get the phone nearby, and it should take care of it.
I've always
Got it.
had
Okay.
bottles.
Thanks.
I've never had boxes.
I've seen a few, prescriptions come in boxes and stuff too. But yep, that's all that I had on my list. Thank you all for coming. I think we had a good turnout and good questions. Do we have any more questions?
Yeah, Cody, I have one other question. I did notice in the MyChart app, when you're going to request a prescription refill, if you have more than one pharmacy, you have to confirm the pharmacy. And I'll have mail order for some of my prescriptions because my insurance requires mail order, but then others it'll be pick up at a store or pick up at a pharmacy. And so the way it used to work, or the way it's supposed to work, is for each medication it remembers the setting. But what I have noticed is that usually works if I go in and I order a refill or whatever, and then if I order it, and then that whole prescription is done. It's been processed, it's been it's completely done. And then you go into the app again, it'll remember the settings for each one. But I have noticed a glitch where if you go and then you do another one before that prescription is processed, it'll default to the old setting. So if you, so do you, but so was I was wondering if is that, it's have you had experience with that, first of all?
I have not, but to be honest, I only have like the one pharmacy.
Got
Um,
it. Okay.
I would.
Okay. So I was just going to say, if you get to that step and you have more than one pharmacy, even though the app is supposed to remember your default, there are times when it doesn't. So just make sure you
Yeah, just
double check
be,
that.
yeah,
Make
double
sure
check,
the
triple
correct
check.
option. Yeah, but I've noticed it usually, the glitch usually happens when you have your other prescription that, hasn't been fully processed.
Yeah.
Okay.
You could also maybe try refilling it, if it's one of the in-store, ones that you get, try refilling it through the pharmacy app that you're using. And maybe that would not mess up on you as much.
Well, no, this is me requesting it, like my doctor has to
From the
approve the
provider. Oh, I
prescription.
gotcha.
Yes,
Yeah, I
that's
gotcha.
what that's what I mean. The doctor has to approve the prescription.
Okay.
And so it's like, just make sure the correct box is checked. Pick up at a pharmacy or mail order.
Yeah. All right. Do I have any more questions?
Nope.
Seeing none, I'm going to stop the recording.
Zoom work, please.